Welcome to the Arlington Catholic Herald podcast. This is Leslie Miller, staff writer for the Catholic Herald. I'm joined today by Susan Infeld, parish nurse at St. John Neumann Church in Reston. Susan was one of the people interviewed in this week's issue of the Catholic Herald for our cover story on Faces of COVID-19, which looks beyond the rising number of cases and tells the stories of some of the real people and families affected by the coronavirus right here in the Arlington Diocese. Thanks for joining us, Susan.
Thank you so much for having me.
One of the things you talked about when I interviewed you for the Herald was how the pain and suffering caused by COVID-19 goes way beyond the people who are actually infected by the virus and ripples out to families and loved ones, especially people with family members in senior care or assisted living facilities. Can you talk a little about how this happened and what the families you've been working with have been going through since care facilities began locking down in March?
Sure. So when Virginia's nursing homes and assisted living facilities began restricting visitors in early March, that was, of course, an effort to help stop the spread of the virus among the vulnerable elderly. But as a result of that, the entire community's lives changed. And when I say the entire community, I mean the residents, the staff, the families, friendly visitors, faith-based visitors, all had to adjust in enormous ways. So those outside of the facility had to really powerlessly watch from afar. And those inside the facility, many felt trapped. And many were literally fighting for their lives. So nursing home residents certainly are our most vulnerable older adult population. Their lives are totally dependent on the actions and the protection of others. So the typical resident may suffer from a chronic illness or multiple comorbidities, diminished mental capacity, diminished sensory ability, impaired mobility, and oftentimes also in that mix are some socioeconomic limitations as well. But any one of these puts them at a greater risk for illness and for death than the normal population. So denying these residents the advocacy of family, friends, or even care managers leaves them totally alone without the ability to fight for themselves. So now everyone is dependent upon the institutions and the staff of those facilities to do the right thing. So it's honestly a terrible conundrum, and I don't question the need for the restrictions imposed to protect them from the spread of the virus. It is the right thing to do for the greater good. But behind every nursing home or assisted living locked door are sad and vulnerable faces at greater risk for fear and anxiety and depression or neglect. The depression among the elderly is already an understandable issue due to so many losses and physical decline. The older we get, the smaller our worlds become. So imagine the impact of total isolation on your loved one. It's confusing and it's devastating. And one of the most heartbreaking things that I've witnessed is watching a spouse press her face against a window, holding up the family dog to try and let her husband know that she has not abandoned him and that he was loved. So you asked about folks with dementia, and I think they in particular, the family member may be the only person that they remember. And that's the person that grounds them to reality. That's their lifeline. And when that person is abruptly torn away, they're rudderless, and their dementia symptoms exacerbate.
I was just going to say that you, one of the things that you told me is that you're seeing families experiencing a lot of guilt and anger because they felt that if they had been able to just go into the facility, they would have been able to protect their family member from COVID, which might be on their floor or in their wing. And, they felt they could have, if only they had been allowed in to see them, they could have protected them. And that has led to a lot of emotions in the family members who can't get in addition to the people who are in the facility.
No, that's absolutely true. And we have to think about the family member's life has likely for a very long time revolved around their daily visits to a loved one, right? And their role was as advocate and as caregiver. And suddenly with COVID and all the restrictions that are required, that's ripped away. And they too become isolated and depressed and lonely and frustrated and scared. And we have to think that many of these people have been doing this every single day for many up to years, weeks, months, years. And suddenly they can't do that anymore. And then shortly thereafter, their loved one passes away. And the survivors often feel that if they hadn't been prevented from providing that advocacy and the love and the support that they could have prevented their loved one's death. And that's a huge burden. And in addition to that, once the loved one is gone, families are robbed of the usual comfort and rituals of family and faith. And I really think, Leslie, that the healing from this trauma is going to take a long time.
And some of the people have not even been able to have funerals yet.
Correct. Absolutely.
Yeah, going back to the dementia patients and how it's even harder for them being in the facility because they can't remember necessarily why all this isolation is necessary. Can you talk a little bit about the cohorting that you described and why they need to do this in the facilities?
Sure. So cohorting, for those who may not be familiar with this medical term, is placing individuals with the same condition in the same area to limit the spread of a communicable disease. And that's exactly what TB sanitariums were and what leper colonies were. So by its very nature, cohorting due to a COVID-19 infection, one is labeled as contagious, dangerous, someone to be avoided, and that goes for healthcare workers working on a COVID unit as well. So it's alienating and it's frightening and it's lonely, but unfortunately it's necessary to help prevent the spread of the disease. So in the beginning, there definitely was a stigma, I think, associated with COVID-19. And I think that's less so now that it's more understood and it's more widespread. But the COVID patient is definitely stigmatized as a form of a typhoid Mary, who was an Irish cook who transmitted typhoid to 53 individuals, I think it was.
Right.
Although she was an asymptomatic carrier. So it's that stigma piece is awfully hard as well.
Yeah. And there is still so much fear of all the unknowns of COVID and all that we don't know about the disease. And that is leading to skyrocketing stress for everyone. I'm wondering if you could say a little bit about how people are managing all of the new anxieties and fears I know you sometimes deal with addiction issues as a nurse and help families with those kinds of issues.
Mm-hmm. No, that's a very good question. I think many to most are actually not handling it well at all. And it's understandable because we as a country don't have a precedent in our lifetime for something like this. Now we can say, yes, we did have SARS and we had Ebola and we had the early days of HIV, but for the most part, we have been blessedly free to do as we please without fear of infection or the need for restrictions. But this has changed all of that. This is a whole different landscape. So we are seeing in the communities a marked increase in anxiety and depression and substance abuse and also domestic violence. And really sadly and regrettably, psychologists are also predicting that we're going to see an increase in the divorce rate when this pandemic is over. And I think what this tells us is that as a society, we need healthier and better coping skills and stronger communities, especially our faith communities, as places of refuge and of support. So my hope is that on the other side of this, what I like to call the season of COVID, as opposed to this is going to go on forever, the season of COVID, that the emphasis is really going to be, or learning will be on developing and strengthening our skills, our coping skills, and just our communities, versus simply trying to mop up after. Unfortunately, the house is on fire. And I know that during this stressful time that all of us so empathize with the suffering individuals and families and the caregivers. And we need to encourage and continue to encourage them to seek spiritual and psychological counseling for support. Their mental health is a huge part of recovering from this COVID-19. It's not just a physical problem.
Can you describe a little bit about your role as a parish nurse and how you walk with people and the kinds of support and advice and education you provide?
Sure. But before I get to me, I really want to do a shout out to the bishop and to Catholic Charities, because I think they've done an amazing job. I really am so proud and so pleased that right out of the gate in mid-March, the bishop stepped up and suspended in-person masses and gatherings and supported the Virginia governor's stay-at-home orders. And I think that has been huge here in Northern Virginia in flattening the curve and keeping our faith community safe. And at the same time that he was sort of, protecting the flock, they instituted online mass and encouraged private visitation. And of course, the exemption was in place for attending mass. And then following that, once the Virginia phases became less restrictive, really continuing that message of you can still stay home, the exemption is still in place, but if you're coming to church, keep the social distancing, keep the mask requirements for parishioners, strict facility cleanings, continue to do the online masses, and all of these pieces have allowed the parishioners in our diocese to stay connected, which I think is amazing. And I think many individual parishes have done amazing jobs of creatively serving their parishioners and the larger community. And Catholic Charities, which is near and dear to most of our hearts, their efforts during this pandemic really reminds me of the loaves and the fishes. Just tremendous leadership and creativity and strength and volunteerism, and it's really, it really is truly an example of living Jesus. And in terms of my work at St. John Neumann, I'm part of a team, and I'm so proud of the outreach and the support that St. John Neumann has done to help those struggling with so many effects of this pandemic. And as a parish nurse, yes, I can truly walk the walk with those struggling with questions about the pandemic, as well as help coordinate medical or psychological, even end-of-life support when needed. That's really where my role steps in a very practical way. Our priests and deacons are right there anytime the phone rings, or if I call them for a family in need of counsel or sacrament or spiritual direction. What a blessing. What a blessing and support to me. It's my role as parish nurse and to our community. But I truly have to say it's the entire staff of St. John Neumann. They are the most dedicated and supportive that is a professional nurse that I've ever worked with. And I think COVID has brought us tremendous new challenges, but I think it's also brought us great opportunities. And I think that we are meeting them with strength and compassion. And we are very, very blessed to be together during this very difficult time.
Yeah. Well, thank you, Susan, for all that you're doing and for all that your parish is doing. And thank you for speaking with us about this important topic today and in this week's issue of the Herald. In other news, in the current issue of the Herald, read about the new St. Isidore of Seville Catholic Virtual School, which just launched for the new school year. For more school news, look for the Herald's Back to School issue, September 3rd. Thanks for tuning in. As always, read more from the Catholic Herald online at catholicherald.com or subscribe and get every issue in your mailbox to stay inspired and engaged. Call 1-800-377-0511. This podcast was produced by Jim Solitsky and Matt Riedel.